Heroin and opiate deaths are so common in this day and age that the increasing number of drug-related deaths are becoming more common every year. According to the U.S. Centers of Disease Control, the U.S. is in the midst of a severe epidemic of opioid addiction and overdose deaths. Overdose deaths involving opioid painkillers increased to about 17,000 deaths per year in 2010, and that's 4 times the amount of deaths in 1999. This increase coincided with a nearly 4-fold increase in prescribed opioids for the treatment of pain. And because people can get prescribed painkillers so easily, they're becoming more addicted to it. Heroin and opiate use not only affects the user's body, but their everyday life as well. Overuse of these drugs can cause damage, grief, and even death. And now we're going to go over what addiction really is, the effects, the withdrawal, and even the treatment. What is addiction? Addiction is a chronic, often relapsing brain disease that causes compulsive drug seeking and use, despite harmful consequences to the addicted individual and to those around him or her. Although the initial decision to take drugs is voluntary for most people, the brain changes that occur over time challenges an addicted person's self-control and hamper with his or her ability to resist drug intents and impulses to take the drugs. And this is from Epic Behavioral Healthcare. And now we're going to go over what drugs actually do to the brain. Drugs contain chemicals that tap into the brain's communication system and disrupt the way nerve cells normally send, receive, and process information. There are at least 2 ways that this drug can cause this disruption: by imitating the brain's natural chemical messengers and by overstimulating the reward circuit of the brain. Some drugs, like marijuana and heroin, have a similar structural chemical to the messengers called neurotransmitters, which are naturally produced by the brain. This similarity allows the drugs to fool the brain's receptors and activate nerve cells to send abnormal messages. Both of these came from Epic Behavioral Healthcare. There are many different factors that can lead a person to drug use. For example, bad relationships, hard times, becoming addicted to prescribed painkillers, and wanting a better high, etc. And in this cycle, it just shows that it starts in the mind, and then you can go from the fantasy to the ritual, acting out, and shame, and then the cycle just reoccurs over and over. Now we're going to move on to side effects. Heroin and opioids can have several different side effects on the body after use. Immediate signs of heroin use heroin use include warm, flushed, dry skin, heavy limbs, and euphoria. With time, heroin causes abusers to alternate between wakeful and drowsy states, at which point nausea and constipation may occur. So this just shows the immediate, which is the warm, flushed, dry skin, dry mouth, heavy limbs, and euphoria. The after effects, which are the wakeful and drowsy states, nausea, constipation, and then the extreme, which would be suppressed breathing and even death. Occasionally, when consumed in large doses, is when the death occurs. And at first, using heroin induces feelings of euphoria followed by pleasant drowsiness. Initial high lasts only 4 to 6 hours. Once a heroin user develops a tolerance, however, high only lasts 2 to 4 hours. After the heroin user needs another fix, they need another fix to maintain the desired effect. Drug use over time does have a long-term effect on the body and can create serious problems. And the long-term problems are going to be the collapsed vein, abscesses, liver disease, infection of heart lining and valves, and then you can also have death. And let's see. And then we're going to go through the next step, which is withdrawal. And withdrawal is when the addict's body has become so reliant on the drug to function normally that it now is causing adverse effects. The withdrawal symptoms can include nausea, shaking, cramps, headaches, and death. And then now we're going to go on to treatment. And for treatment, this is when a person is willing to stop heroin or opioid use to go under treatment at a rehab facility. Rehab facilities offer different programs, support groups, and they even come up with an individualized treatment plan for the patient. The first stage is usually withdrawal and stabilization, also known as detox, which helps the clients safely discontinue their opioid use while minimizing withdrawal symptoms. Medication-assisted treatment uses medication like Suboxone to help clients control opioid cravings, allowing them to feel and function normally. Once an addict completes rehab successfully, they can attend meetings and they can even have counseling to help them stay sober. And this is just showing the addiction cycle: emotional trigger, craving, ritual, using, guilt, and then they'll keep feeling all these symptoms and just repeat the cycle over and over again. These powerful drugs are taking over lives and causing the epidemic today. Painkillers are easily prescribed and lead to long-term addiction dependency on the drug. Brain imaging studies of drug-addicted individuals show changes in the area of the brain that are critical to judgment, decision-making, learning, and memory, and behavior control. Together, those changes can drive an abuser to seek out and take drugs compulsively despite adverse, even devastating consequences, says Epic Behavioral Healthcare. When an addict overdoses on heroin, there is a drug administered called Narcan. This drug can reverse the effects of an overdose given at any time. And they're actually now training people to use Narcan because you're going to have it more common when you go out in public places. And there are help and support hotlines and groups to help families and loved ones struggling with addiction.